Welcome back. Final conversation here for Breakfast Extra. Now, the death of Ifunaya Nwagene after a snake bite has reopened a quiet but deadly crisis in Nigeria's public health system. Snake bites kill thousands across the country every year, mostly in rural communities where access to timely care is limited. Now, antivenom is scarce, it's expensive, and often unavailable where it is needed most. In many cases, victims arrive at health centers too late or are treated without the right drugs. What should be a survivable medical emergency to, well, it often becomes a death sentence.
Joining us now to unpack this are Taiwo Okikiola, herpetologist.
Yeah, let the biologist in the house do that, yeah.
And Chinedu Mogbo, the director of Greenfingers Wildlife Initiative. We will look at the science of snake bites and failures in medical responses and what practical steps Nigeria must take to prevent more avoidable deaths.
Chinedu, you're welcome. Thank you very much. We have you for now, if I'm not mistaken. Now, Chinedu, we're wondering exactly, the situation that we saw with Ifunaya, very, very sad one. However, there is plenty to unpack when it comes to these instances. So from a public health point of view, or maybe even policy angle if you want, why is antivenom still so difficult to access in Nigeria?
Thank you for your question. Now, there's quite a lot of issues. We are definitely, but we're not shocked at the incident which may have happened because it's not the first one that we've heard of. And since then, you would think that we would take steps. Hospitals will take steps. Snake bites are one of the most underreported cases we've seen of deaths here in Nigeria. Just like malaria, snake bite is a tropical disease, just like your other diseases. And the failure to take steps to ensuring that antivenom, yes, we understand the process of making antivenom could be very expensive, needs extensive research, and storage of these antivenoms also should should be considered, because if not stored at the proper temperatures, they may actually go bad and become less viable. So these are some of the challenges, but the failure of the government, higher institutions. I mean, we apparently we do have a snake research lab somewhere in the north, and the question is, what is their responsibility? Do they get funding? And even if they do get funding, what is their responsibility in ensuring that these snake venoms get to at least, even if it's the federal hospitals all around Nigeria, because they are snakes. We have many venomous snakes. We have the gaboon viper, we have the forest cobra, and we have boomslangs, whose venom are potent enough to kill people. So if we know we have these problems or these animals, and they're not in small numbers, they're in large numbers all across the country, why will we not take better steps in ensuring their antivenom?
Now, Chinedu, from the research that I have done, and I stand to be corrected, Mazino, Nigeria does not necessarily have free medical health care. I know that there's a subsidy or whatever it is that you have to pay if you're going to a general hospital. So when we want to now incorporate and involve the government, what role do we say that the government should play in funding and distributing antivenom nationwide?
Well, the government should play a major role, even if it's not even if it's not free. I mean, there are public hospitals, and even in public hospitals, people do get, even though it's some subsidized amount, people still get to buy medications. And snake bite it's not preventable, but then again, it has to be provided. The remedies, the cures have to be provided, even if it's in private hospitals, even if private hospitals decide to do that. But however, government hospitals, because government, they have the funding. There is a federal ministry, there's a ministry that has the locations, Ministry of Forestry, these Ministry of Health. They must consider that these are possible problems. I mean, we have to come beyond being proactive, because that's mostly what we do in this country. We are very proactive, very reactive than being proactive. So why is the government saying it's too difficult to sponsor or to produce antivenoms? That's one. Then we have laboratories scattered across the country. Universities, students studying zoology, students going into research, because we can already see that there's a flaw and there's a problem with our research, with the students who can't even do a research because they don't have the funding or they do not have the necessary provisions. So we will definitely see that government can do this if they want to pay attention to this. But it's clear. When you think about animals, anything that has to do with animals, government wouldn't really put too much emphasis on it. And because this has to do with animals also, we've also seen that that's why one of the reasons government, they are not even really concerned about issues like this.
Thank you, Chinedu. We have our herpetologist online with us, Taiwo Okikiola. Taiwo, thank you for joining us for this conversation. Very interesting that you're joining us now, because I want to know, you're a herpetologist, and I'm wondering what the institutions, what their responsibility is here. Every single year we get graduates who come out, who go on to also, further in research. What are the institutions doing to encourage data, especially in places where you might have these animals that might eventually bite people, like we saw in the case in Abuja? Are the institutions responsible for any kind of data, any kind of advances in anti-venom? What are the institutions doing?
I think we're not putting much effort. I have written to offices, not one, not two, regarding creating a body that controls the sourcing for antivenom, lecturing about our snakes, how to avoid them, how to know if a snake is around you, how to know if a snake is in your house, and so many things. But I don't think those letters are even opened, talk less of being attended to. So I believe that the snake bites, like someone said, is a report that Nigeria do not really take serious, because in Africa we have over 20,000 snake bites in a year, and in Nigeria alone we have over 2,000 snake bites in a year, and that's quite a big number. So I believe that we should do better. Antivenom are not supposed to just be in primary health centers or just hospitals. They're supposed to be provided at premises too. Yes, it is cost, and you need like 2 to 3 doses depending on the type of snake that bits you. So I believe that if the government can create or allow us have a body that controls this, we wouldn't have such reports again regarding snake deaths. It's normal for snake to bite. You cannot avoid it. It's not preventable. But dying from a snake bite is not supposed to still exist in 2026.
Not at this day and age. Taiwo, there's something else I wanted to ask. During the course of the week, I was doing research, I was doing research actually about snake bites, and I actually found one that says if you tie a region where you have been afflicted by a snake bite, it's actually worse off. And I was wondering, Taiwo, is this true? When you are bitten by a snake, what's the first thing that you're supposed to do?
Yes, you're right. It is wrong to tie the spot at which you got bitten. When you're bitten by a snake, the first thing you have to do is to control the way you breathe. That means you must not panic, because what panicking does is increase your heartbeat. And once your heart pumps too much of blood at a time, it helps this venom spread quickly. So the first thing to do is to stay calm. No movement at the spot at which you got bitten. If it was your hand, you must not move it. You must treat it like a broken bone. So the hand or the leg or any part of that body must stay still. Then if you could get help, avoid shouting. Anything that is going to make you panic or anything that is going to make your heart start beating fast, you must avoid it. Get help. When you get help, you can get a pipe or a broom or even ruler, or you can also get a plastic. Just attach, if let's say the snake bits you at this point, now the venom will start spreading from this point to this point, then to your organs before shutting each of your organs down. So let's say you got bitten by this point, you can find a pipe that is this length, attach it to the point, then get a bandage, not a rope. If you don't have a bandage, get a long scarf, something a little bit soft. Then wrap around your hand and whatever you choose to attach. You can also get a stick, yes. Anything that will not make this hand shake. Attach the bandage to your hand, secure the stick and your hand together so it restricts the venom to these parts of your body. What tying does is it destroys your limb. Once you tie it too tight, then the venom will start making your that part of your body start getting swollen, and before you know, it might lead to amputation even after the antivenom, depending on the snake that bits you. So after doing that, do not move the hand, just stay still, get help. If you can drive, yes, drive slowly. Don't drive like, oh, I'm going to die, so I'm going to die. You drive slowly to the hospital. And once you get to the hospital, of course, they're going to ask you what type of snake bit you, because you need to be treated according to the snake's antivenom. But there is a general antivenom now that I believe that when this government allows us to create a body, this general antivenom can actually go around for every snake that we have in Nigeria, because we do not have many venomous snakes in Nigeria. There are over 4,000 species of snake on Earth, and just 500 are venomous.
Taiwo.
So Nigeria has to be a home to snakes that are non-venomous. The only threat we have in Nigeria is the boomslang, the Jameson mamba, the Gabon viper, puff adder, forest cobra, spitting cobra, and a bush viper.
Yeah, it's okay. Thank
Taiwo.
you. Yeah.
Yeah.
You know, I watched snakes on the...
So when you get to the hospital, they would ask you, and if you could recollect, fine. And do not attempt attacking the snake after a bite, please. Leave the snake alone, let it go, because there are cases whereby you got bitten again trying to kill the snake.
Taiwo, can I just interject? Thank you so much for that information. I think it's very crucial, Mazino, because all the snakes I know are the snakes I saw on snakes on a plane. But I want us to have a real conversation. In as much as you're giving us the advice, which is extremely valuable, let's talk about the realities in Nigeria. And of course, we can use Ifunaya's case as an example. Hypothetically speaking, especially because right now, hospitals may not have the anti-venom. So after we have done everything that you have advised, what happens if a person gets to the hospital and there is no anti-venom? Is there a possibility to survive without getting the anti-venom? Taiwo?
There isn't.
Oh.
Tradomedicals actually have an anti-venom for mostly cobras, but I don't think they are also paying more concentration on that part, creating an anti-venom that actually works for people that cannot afford the real anti-venom. So if that person gets to the hospital and there's no antivenom, I'm sorry, it's going to be a bad news. And again, if the person gets to the hospital late again and the antivenom was injected into her very late, it might still not work, because each snake bite has durations in which their venom can be in your bloodstream.
Oh, Chinedu, I'd like to move to you. Can you give me a response to this? Is there a way to divert the bad news that Taiwo just spoke about?
Clearly, all she said is actually very right. But sticking to understanding the traditional aspects of it, we also need, and it's also limited, because even in the medical, when polycystic or polyvalent venoms are created, they can work for a wide range of snake bites. But unfortunately, there are some snakes that you need a different kind of antivenom called the monovalent antivenom, which can only work on such snakes' venom. And that is why, I mean, yes, we look at the realities of Nigeria, but we really also need to understand how important this is. We speak about this so that we won't put snakes, we're not putting that fear by saying there is no hope, and thereby let us eliminate every snake within the planet or within the continent, within Nigeria. But we should just look at how the roles they play, which is very important, and what we should do, and the providing these safety measures for snake bites, which is very, very crucial and critical. This will not be the last time someone will be bitten by snakes or venomous snakes. So wouldn't we now begin to make those things available? And that's the question we need to answer.
Now, Taiwo, I'll come back to you. I have a dog, and one of the reasons why we did get dogs is because most of the time when snakes are present, dogs would react and bark. Outside of me having a canine animal, how do I tell in my surroundings if a snake is present?
All right. The very first fact to know if snake is present is seeing their skin shed. Some snakes shed every week, some monthly, and some in 3 months. It depends on the size. But once you notice a skin shed in the perimeter of your home or inside your house, a snake is definitely around. The Yorubas made a myth that once you see a snake skin, it means that it simply means that the snake has gone far away. No, it does not mean that. It means that the snake has been shedding somewhere. You're just opportune to see that one. And once you see it, you need to either fumigate or start checking your corners. That's the first thing. The second thing is they have a musky smell. For people that knows how their house smells, when the snake is around you, it is going to smell different. Now, it depends on if you're paying attention, because the smell is nothing really, really serious. But then if you pay attention very well, at that particular place, maybe your room or the kitchen starts smelling differently. That's another way to know a snake is around you or in your house. Another way to know is when you live in a rat-infested area where rats keeps disturbing you and you do not own a cat. You are not taking measures to drive them away, or let's say the measures you're taking has been failing. Probably this rat gum, rat poisons has been failing, and you know that this place that's disturbing me, and all of a sudden, drastically, the rats went away on their own. It also means that a snake is around you, because these are things that they come for. They simply come for food and shelter.
All right,
that's
then,
why they're in your home.
Taiwo, we do appreciate the details that you've given us regarding how to especially identify if you've got snakes around you, and also what to do if you are ever bitten. And Chinedu, thank you for the details that you've also given us regarding this matter. We do commiserate with the family of Ifunaya in Abuja. They're a very unfortunate instance.